especially coming from mental health and as a psychiatrist, we are taught, we are trained to think and believe that that cannabis is absolutely the root of all evil. It's
absolutely.
There's no place within the medical space. Then I actually started in 2019 working within primary care, and I started seeing high-functioning, really able patients that were using cannabis and actually managing their symptoms very well. Whereas I was having to prescribe medications to counteract the side effects that they were getting from their traditional medications. Then it made me think, actually, hold on a minute, there is potentially a role. Then I started doing my own research, looking into it, and again, fortunately, the legislation changed, gave me an opportunity to get involved in this space, and I haven't looked back. I think significantly for both patients and for prescribers. So for patients, I think the fact that more clinics are coming into the market, that has brought with it more products, more strains, better quality strains as well. I think that's brought the cost down for patients, which is really, really key for getting patients over to the medical market.
Interesting. I mean, one of the functions that we're going to do at Lumir Clinic is we're focused very much on the research base. And I think that's what attracted you to come and work with us.
Exactly.
And I think that for us, being at Birmingham University, working with professors inside of the campus, developing research protocols to understand this. And one of our big things is citizen science, understanding and working with patients to actually gather big data to really get a picture of this. So when you prescribe, and obviously there's a wide range of products available, from oils through to flour, through to now liquid vapes, and then I've heard potentially we'll be getting extracts in the near future. How do you choose which one?
Based on quality and reputation is what I foremost look at. So quality products, and hence why I wanted to come with Lumir, the brand, the quality, it's known in the industry. There's certain Canadian brands that are very good. They're also very good quality. Start with that, and most of the time patients report extremely beneficial results. And that's directly linked to the quality in the brand.
Yeah, I think for us, the big thing about medical cannabis is that people don't really know that it's available at the moment. The more people I speak to, the more they just didn't know that it was legal. And whenever you hear a news story and it has something to do with cannabis, they never actually say that there's legal access medically to it now.
And that's a bit of a frustration. I think that's because of the restrictions that MHRA and advertising put on us. Unfortunately, it is still spreading within the community and word of mouth, but that pace is very slow. And I think a lot of patients don't know, because they don't know that it's available, they assume that it's only for a certain demographic of the population. We've done a recent qualitative study looking at our patients in one of the clinics I work for, and it's come out at 76% of the thousands of patients within that clinic are employed, in full-time employment or in some form of employment. And I've got myself patients that are in every aspect of the industry, so from the legal profession to civil servants to clinicians to teachers to even within veterans as well. So within every aspect of employment, there are patients who are using medical cannabis, and it helps them maintain their job. So that's also feeding into recruitment and retention for the industry and for the economy and the government.
I think one of the big things at the moment is that police forces don't really understand that medical cannabis is widely available and it can treat so many different conditions because of people's endocannabinoid system and the whole fact that still, when you come into contact, even as a patient, with the police, and I've heard that some police officers are getting prescribed medical cannabis, so you'd have thought that the police would be much more au fait with the regulations.
So I have police officers that are patients as well. The game changing for them, because obviously the trauma that they go through, the difficulty within their job that they've gone through, especially in the recent years in the UK, the riots and all of the issues that we've had, it has kept them in their job, and they're so grateful. But again, they're restricted because the police force doesn't have a framework to operate on. So what I was really keen about, being the medical director for Lumir, One of the main things is we have an academic backing now.
Yeah.
We are the first and only clinic to have an academic backing, which means that we have credibility to start putting in policies to help those organizations such as the police force of how do they treat, and if a patient says, I'm a medical cannabis patient, what do you need to do? What do you need to look for to confirm that they are a medical cannabis patient? We have the backing of the university, eminent professors, Professor Zabir, Professor Genome. They are all industry leaders. They even help to bring in the legislation for medical cannabis. So that would be really powerful to help us push this forward and support organizations such as the police force.
In the legislation currently, you are prosecuted if you're drug tested and you have 2 micrograms of THC per litre of blood. That's considered over the limit. Now, to put that in context, that actually means if you used cannabis on a Sunday, you would probably still be testing positive on a Thursday. That's an instant 12-month ban. Now, with medical cannabis, you have a medical defense and you can exceed that 2 micrograms limit, but you cannot be impaired. And I think this is something that the police forces have yet to really get a handle on and move forward on. And I think that's why it'd be really useful for us to engage with police forces, and you in particular, to be able to go in there and explain to them the benefits that patients get.
It's complete irony, because I prescribe, again, within the mental health space, a lot of medications that cause drowsiness or impairment. But you're never sort of prosecuted or penalized for having those medications in your system. The medications we prescribe, for example, for antidepressants, they will make you drowsy in the morning, or the benzodiazepines that will undoubtedly impair you, but you're not prosecuted. Whereas this, it helps patients with focus, helps them remain calm, makes them less anxious, but just having that in your system could then lead to you losing your license. So that's why when I see patients, the biggest thing for me is, even from a psychological point of view, they always tell me 50% of their anxiety is automatically gone by just getting a prescription. They haven't even received the medication yet, but knowing that they're legally covered and knowing that they won't be prosecuted or taken to court, they won't lose their job, they won't lose their license, they can still drop the kids to school, all of those basic things, and they haven't even, and that's before they receive the medication. Then the fact that when they get their medication, one, it's clean, it's pure, they know what they're getting, and also they can actually use it as a science. They can look at the symptoms, they can transfer, actually, was it that terpene that I got, or was it this, as opposed to what my friend said it was and what percentage it was, and they don't know. And secondly, when the medication's running out, they don't have a panic. A lot of patients tell me, when it's running out, I start panicking because I'm going to have to go and make that trip again. And obviously they can't go to they have to make the trip to the other side of town. And this is so simple. It is order your repeat online, give the clinic a call, request what medication you would like, and it gets delivered to you, and that's it. It is game changing.
And one of the things that has been really important with working with Birmingham University and Professor Zabir Ahmad has been that they've actually researched street cannabis. So they found arsenic in it. They found plant growth hormones. They found all kinds of materials that you would be absolutely loath to come anywhere close.
Fiberglass and all of, the list was endless. It was ridiculous. Absolutely, And
then this is, when you're using street cannabis, this is the kind of environment you're in, and the medication that you think you're using to get therapeutic benefit may actually be causing you more harm than damage because of that.
There's a misconception and a miseducation for patients using street cannabis. They are told wildly exaggerated, for example, THC levels. These aren't tested. These are with medical cannabis. It is fact. They all come with certificate of analysis, Home Office approved, it's been checked, even from the transport, the temperature has to be checked and it's consistent. So the layers of from where it's grown to packaged to come, we know exactly step by step what's gone into it to keep it regulated and consistent. And it's that patients even say that consistency. They need it to be consistent every time. That when I use it, I got the same effects, it's going to manage my symptoms. And not when I use it, at one point it made me stimulated, at one point it made me drowsy, or I got sick, or ended up in that. that whole aspect is eliminated.
That's where I do a lot of my work in the importation of cannabis into the UK. And the regulatory framework we have to go through is changing, but becoming tighter. And the actual processes we have to go through are very detailed. So when we import, remembering this is a plant, this is effectively a herbal medicine. So the process is the UK recognises a 10% variance in the active ingredient. The active ingredient in cannabis that the MHRA, Medicines Healthcare Regulator, approve is THC and CBD. So you get 10% variance in the label claim between batches. So that becomes very difficult, which means that it has to be very tightly controlled in the way that it's grown. So there are all of these safety areas that are covered within the legislation that governs this. And for the better, to be honest, because it makes sure that the medication that arrives here is consistent. And one of the things that is really a common talking point in cannabis, and I don't know how you feel about this, is this idea of irradiated and non-irradiated cannabis. So let me, for people that aren't aware, irradiated cannabis is treated to make sure that any of the colony growth, as it's termed, bacteria, microbes, are limited by going through a process that basically reduces the possibility of bacteria growing on there. But people perceive that to damage the cannabis. And to a certain extent, in the terpene section of cannabis, because cannabis is made up of cannabinoids, terpenes, flavonoids, esters, there are all of these bits in there that make up this what's called synergetic effect. So when it goes through this process, there is a reduction in the terpene profile, but does it make a difference to the medication itself?
No. So two things with that. You're right, absolutely. But some studies have shown it can reduce up to 30% of the terpenes.
Right.
So that's one. Obviously, terpenes are the ones that give it a lot of those smells and tastes exactly like you said. I have prescribed, I think, nearly every strain that's available in the UK, previous, discontinued, all of those. I believe from the feedback from patients as well, that there is no set rule that non-irradiated is better than irradiated and vice versa. Some irradiated strains have absolutely phenomenal benefits, and the feedback from patients, they are better than some non-irradiated. Obviously there are practical elements to it that we need to look at and we talk to. So patients that are, for example, more immunocompromised or more at risk, it would be safer for them to have irradiated medical cannabis than non-irradiated. However, and what I like about Lumir Clinic and being involved in the policies and so on is we allow patients to have that choice. They have free access to trying irradiated, non-irradiated, see which one is better for them. And it comes down to, it's not, like we always said, it's not about the THC, it's not about the irradiated, it also comes back down to the terpene profile, or a lot of different factors that is not just linked to irradiated, non-irradiated.
Absolutely. And one of the things we're really keen to do is turn this into a personalised medicine. I think this is really important. Cool. So, as I was saying,
shopping channel,
as I was saying, we're turning it into a personalised medicine. So we've got a DNA test that actually maps your endocannabinoid system. I think it's important to understand the endocannabinoid system, and I will do a separate video on that. The endocannabinoid system is in essence the engine management system of your body. It modulates all of the processes going on. And what this DNA test does is it actually maps your endocannabinoid system and then allows the analysis. This is peer-reviewed science that is behind this. It maps your profile so that you understand how you respond to THC, CBD, and the terpenes. So my particular response profile is I'm very suitable to THC, but I have to consume lots of CBD because I'm a super processor of CBD. So my particular response, also my terpene profile map, means that certain strains don't agree with me. They make me anxious, which is one of the things that is commonly said about cannabis. So it's a fascinating science.
But I think this has come at a best time now, especially I always said 2024 is quite good for patients as well, because there are a vast variety of strains.
Yeah.
When I started in this industry, there were a handful of strains.
Yeah.
When they went out of stock, you just
Yeah.
had to wait.
Yeah.
So having such an endocannabinoid it would be a bit futile because you don't have the choice.
Yes.
Whereas now there's so
Yes.
many options, we
Absolutely.
can actually link it to the different terpenes that may be best suited for you.
Interesting.
What I found also really, really potentially useful for this kit is those patients that may be potentially not eligible for medical cannabis. This may provide a bit more reassurance, one to the clinician and also to the patient that it's safe.
Yeah.
So those that may have a family history of, for example, schizophrenia or psychosis, this would identify the potential risk of, and if that is within a suitable range or acceptable level of risk, we could still then prescribe medical cannabis for that patient, which would otherwise be not suitable.
Well, it's interesting because we were talking to Macmillan Cancer Support last week, and they were talking about the genomic response that they're plotting and moving forward. So all of these things are moving forward. We're all uniquely individual. Everybody's endocannabinoid system is different. There's a difference between male and female response as well. The reproductive system is closely profiled by the cannabinoid system. So there are lots of things that we're going to explore and develop. And this is part of that citizen science project that we want to work with in the Lumir clinic. So once again, thank you very much for agreeing to be our medical director. And we really look forward to working with you and developing.
It's a very exciting time. Thanks, Tim.
Cheers now.